Hello guys, today I will discuss about the rest of causes of malabsorptive diarrhea. The second common cause of malabsorptive diarrhea is pancreatic diarrhea, and any disease of pancreas can lead to deficient pancreatic enzyme, which are very important for digestion of food. Obviously, when there will be no enzyme, there will be no digestion, and ultimately it will lead to malabsorptive diarrhea. And the diseases which can affect pancreas, they include CA pancreas, and then the recurrent attacks of acute pancreatitis ultimately leading to chronic pancreatitis. It also leads to deficient pancreatic juice or pancreatic enzymes, as well as it can also lead to defective endocrine functions of pancreas. Then there can be some congenital condition which can affect pancreas, like cystic fibrosis, which is a congenital condition in which there are thick secretions, and these thick secretions, when they are present in the pancreatic duct, they block the duct, and hence there are no pancreatic enzymes to digest the food. Then pancreas divisum is a structural abnormality. Again, the reason is the same, that there are no pancreatic enzymes, and that leads to malabsorption. Now, how do we investigate and how do we manage such patients are? First of all, we see the clinical features. Clinical features of pancreatic diarrhea, it can be according to the underlying condition. For example, it can be recurrent abdominal pain radiating to back with bloating, vomiting, and then after that, obviously diarrhea, which is prominently steatorrhea, that is fat malabsorption diarrhea. And then there can be weight loss if there is underlying malignancy, and there can be multi-system involvement if it is cystic fibrosis. So investigations are basically, we do fecal elastase test, which is actually a pancreatic enzyme. In case of pancreatic insufficiency, fecal elastase is less. And then we can go for a CT scan for with pancreatic protocol to see pancreas. And if we see that there is, or if we suspect if there is any obstruction or any structural abnormality in pancreatic duct or pancreaticobiliary tree, we can go for MRCP, which is scanning of biliopancreatic channels. And then after that, we can go for ERCP, both for diagnostic and therapeutic purposes. To therapeutic purpose in a sense that we can place a stent, and we can relieve the obstruction, and hence we can help the patient in relieving the symptoms of diarrhea. Other than this, if we cannot do all these, we can give analgesia to the patient, that is symptomatic management. Then pancreatic enzyme supplements and fat soluble vitamins, they can also be given, because there is deficiency of vitamins which are soluble in fat. Then there are miscellaneous causes of malabsorption diarrhea. Any iatrogenic trauma during surgery or any exposure to radiation, it can lead to loss of absorptive surface of the gut, and hence it can lead to malabsorption diarrhea. Then after that, we can have other causes of malabsorption diarrhea, like bile salt malabsorption. Bile salts, they are actually reabsorbed from terminal ileum. In any ileal disease, it would lead to decreased reabsorption of bile salts, and when bile salts will not be reabsorbed, obviously there will be deficiency of these bile salts, and they will produce diarrhea, which will be basically steatorrhea, because they are needed for fat absorption basically. Then there is another diarrhea which is malabsorptive, and it's very very rare, but I need to discuss it here because it might come in exams, and it's important scenarios in international exams as well. That is Whipple's disease. Whipple's disease is a multi-system disease. It is caused by gram-positive bacteria Trophirema whippleyi, and it can affect CVS, CNS, GIT, and then joints, and after that it can cause skin pigmentation, lymphadenopathy. Obviously, it can involve gut, and patient can present with diarrhea. So basically, the definitive diagnosis is biopsy, and in the biopsy, the characteristic picture is macrophages containing this bacteria, and these macrophages, they are foamy, and their periodic acid shift positively stained. The treatment is prolonged antibiotic, that is for 1 to 2 years. These can include Septron, Ceftriaxone, or penicillin. So this was all about malabsorptive diarrhea. Other causes of the small gut diarrhea will be discussed in the next lecture. Thank you.